Hello everyone, I am Dr. Manoj Bachcha, plastic and cosmetic surgeon from Elite Cosmetic Surgery Center, Nasik, Maharashtra. Today we are going to discuss about one of the very common problems nowadays we are seeing in our OPD, and that is varicose veins. So we are going to talk about what is basically varicose veins does mean, why these varicose veins are formed and how they are formed, what are the complaints or symptoms you get after developing the varicose veins, who are the people who are more prone for developing the varicose veins, how we can prevent varicose veins from occurring, and finally we are going to discuss regarding treatment options for the varicose veins, including conservative treatment, lasers and surgery. So we will start with the first thing, that is, what does the varicose vein means? So varicose veins means dilated tortuous veins of the lower limb, superficial veins of the lower limb. So basically if you see a dilated bluish colored vein which is tortuous and dilated in the lower limb, this is called as varicose veins. Now why does this varicose veins are formed and how they are formed? So if you can see in the diagram, if you consider the lower limb, there are two systems of blood vessel. One is arterial system and another is venous system. So arterial system brings the pure blood from the heart towards the periphery, that is the lower limb, and the venous system that brings the impure blood from the periphery, that is from the legs, upwards towards the heart. So basically veins has to carry the blood upwards in the anti-gravity manner. So how do the vein function, how the blood is carried in the upward direction? So basically if you consider the vein, it is very thin walled structure and it has walls at certain distance. So these are unidirectional valve and the blood is pumped in upward direction using the pumping action. So during the pumping action, the walls are opened in upward direction, the blood goes up, and due to the closure of the wall, it doesn't go down again. So progressively the blood that climbs up. This is the way the blood is pumped in the upward direction. Now due to prolonged standing or due to some reason, these walls they become non-functional or dysfunctional. So due to the dysfunctional wall, the wall becomes loose and it doesn't close as it should close normally, and the blood seeps down due to the gravity. So as the blood goes down, the vein is dilated and the walls below that level, they are separated apart, and due to the separation of the wall, they fail to function normally and the blood again accumulates into the vein. So if you consider a thin walled pipe with excess of water in it, as it becomes dilated and tortuous, these veins, due to excess blood, they initially become dilated and then they become wavy or tortuous. These tortuous veins are called varicose veins. Now what are the symptoms? How do you identify the varicose veins? So first and foremost thing, due to these dilated veins, the veins which are deeper inside the skin, they become superficial and they are seen as dilated bluish veins. So it's the first symptom of the varicose veins, that you see the dilated tortuous veins through the skin. Now furthermore, what happens due to the stretching of the venous wall, the wall that is stretched and there are small pores, they are opened up, and some blood components they seep through that pores like hemosiderin, and these are deposited beneath the skin, and due to this pigment there is a black discoloration of the skin. Also it can cause itching also. This dilated vein can cause the cramping or the dull aching pain in the calf and the thighs, that is in lower leg, towards the end of the day. So these are some of the symptoms. Now if we don't stop the progression of the varicose veins, what happens? Due to continuous pressure of the venous wall on the skin becomes thinned out and ultimately it breaks and there is a wound or an ulcer is formed on the skin. Now this wound or the ulcer, it won't heal unless and until we treat the underlying pathogenic dilated vein. Furthermore, if we don't stop the disease at this stage, the vein wall can rupture and break and there can be venous ulcer bleeding. So these are some of the complications that can happen with prolonged varicose veins. Now another thing that happens due to this dilated veins, that there is stagnation of the blood. The blood doesn't flow in the normal way, so that there can be thrombosis of the, there can be blood clots inside the vein, or there can be infection of the vein. We call it superficial vein thrombosis or thrombophlebitis. These are some of the other complications that can happen with prolonged varicose veins. Now we will see who are the people who are more prone for developing varicose veins. So varicose veins, the most common etiology of varicose veins is prolonged standing. So those professionals who require to stand for longer hours are more prone for developing the varicose veins, such as teachers, doctors, nurses and paramedics, then farmers who require to stand for longer hours. It is more prone, they are more prone for developing the varicose veins. Another reason is that in females it is more common. Then next, in post pregnancy or during pregnancy, varicose veins are common, because during the pregnancy the pressure of the uterus causes the pressure on the deeper abdominal veins, which causes the back pressure in the venous system, and then you can develop the varicose veins. Also there are some medical conditions which can cause the varicose veins. Now before coming to the treatment of the varicose veins, we will discuss how to prevent the varicose veins. So as I have discussed, those who are more prone for developing varicose veins, those who need to stand for longer hours, the simple prevention can be done by using the compression stockings. Grade 1 stockings can be used for prevention. Then they can do frequent exercise such as walking, brisk walking for 20 minutes a day, at least morning and evening, and limb elevation, that is using pillow below the leg while sleeping. So these are some of the simple preventive measures for varicose veins. Now we will come to the treatment of varicose veins. Now as we have discussed, it is a mechanical damage of the venous walls. So any oral medication is not going to repair that venous walls, and you are not going to get regression of the varicose veins. So frankly speaking, there is no oral medication that is going to reverse the varicose veins. There is a tablet called as Daflon, that is a venotonus agent. To some extent it might be helpful, but not definitely won't reverse the varicose veins. And some painkiller can be given temporarily if there is severe pain, but oral medication won't be of much of help in varicose veins. So treatment, what is the treatment? Treatment can be divided into two parts. One is conservative and another is intervention, that is either laser or surgery. So conservative treatment includes use of the pressure garments, limb elevation and walking with the pressure garment. So basically what does the pressure garment, that is compression garment, does is it supports the veins from the outside, so that the varicose veins won't progress to the advanced stages. It won't reverse back the varicose veins, but it won't let the varicose veins progress to complication stage. So it will just stop the disease as it is. So it is not actually the treatment, it is just prevention of complications, and you will get some alleviation from the symptoms also. Actual treatment of the varicose veins is either laser or surgery. So we will first discuss the laser, which is quite much of in use nowadays, very widely used. So that is endovenous laser ablation. So what does the endovenous laser ablation do? What we do, we use a diode laser. We insert the laser probe just above the ankle into the pathological vein, which we identify preoperatively. The probe is inserted usually under ultrasound guidance, and the complete pathological vein is ablated using laser energy. Ablated meaning it is as good as burnt out. Now the question arises that if we burnt out the pathological vein, how the blood is going to flow back. So you need to understand, we are treating only pathological damaged veins. They are already in any which way is not functioning. In fact, they are causing load to the normal veins. So we just treat the pathological veins. There are other normal veins in the leg which are going to function normally. So this is the one way of doing a laser treatment. Laser treatment is virtually a scarless treatment, a painless procedure, and it is a daycare procedure. Patient comes, does the laser and goes back immediately after the procedure. Now next treatment is an open surgical treatment. In that we preoperatively do the Doppler, we mark the pathological vein, we mark the perforators. Perforators are the connection between the superficial and deep venous system. If they are also damaged, we need to tackle them also. And in open surgery, you get a scar in the groin region if the SF junction, that is the main junction at the groin with the superficial vein, that the great venous vein meets with the femoral vein. So that junction, that the scar is at the groin and the multiple level where the perforators are there. So you are going to get 3 to 4 some stab incisions around 1.5 centimeter, and we completely strip the pathological vein. We remove the vein completely with the surgery. This is again can be done in a daycare, or 1 day stay is required for the surgical intervention. Both methods are equally effective. Now the thing, that most common question that is asked by the patients is, so what should we do, whether laser is better or whether open surgery is better, what should be the treatment of choice. So in my opinion, personal opinion, both methods are good, both are effective, though the open surgery has slightly less chance of recurrence. In early varicose veins, laser will be beneficial in my opinion. Personally, I am saying again, but in advanced stage, open will be beneficial, or we can individualize the case. We can use laser along with the perforator ligation to reduce the risk of recurrence. So this treatment has to be individualized depending on the nature of the disease, the amount of the pathological after determining the pathological vein and the Doppler and the clinical evaluation. So these are some of the options. Even post-operative period, pressure garment use is mandatory. So this is regarding varicose veins. One more thing regarding the treatment is that sclerotherapy. Sclerotherapy is done for the superficial dilated veins or the spider veins. It is more of a cosmetic rather than a functional thing. We inject the sclerosing agent directly into the dilated veins so that the veins are burnt out. But if you have underlying perforator or main junction wall incompetence, it won't treat that thing. So this can be used an adjunct to the open or the laser surgery, the injection sclerotherapy. So these are the various options that can be utilized depending on the patient need. So if you have a dilated veins, or if you are prone for developing, if you stand for longer time, start wearing the pressure garment. If you already have a dilated veins, go and consult the plastic surgeon. You need to do a Doppler, get yourself evaluated. If it is an early or very mild varicose, you can continue with the pressure garments. If it is troubling day-to-day activities, then we can go ahead with laser or the open surgery. Thank you.